Hari Om all. Thank you for all joining in. As you all know, we've gathered here for a webinar on how important Ayurveda is for fighting against the COVID-19 pandemic. This initiative was taken by the Rashtriya Ayurveda Vidyapeeth, RAV, of the Ayush Ministry to prepare us for the expected third wave of the COVID-19. AYU-SAMVAD, a series of lectures, will be taken by mentors that have been appointed by the RAV. We are very fortunate to have Professor Vaidya M. Prasad, who has been appointed as one of the mentors. He had reached out to Chinmaya International Foundation for taking these series of lectures for all. Thus, the Seva team has collaborated with Chinmaya International Foundation to conduct this webinar for everybody. And we are very grateful to all those who are present here. And I would like to welcome you all for this event. Now I would request Sharada to take over.
I now request Avani to begin the program with a small prayer.
Sahana Vavatu, Sahanau Bhunaktu, Sahaviryam Karavavai, Tejasvina Vadhitamastu, Mavidvishavai. Om Shanti, Shanti, Shanti. Hari Om Shri Guru Pyo Namah. Hari Om.
Thank you, Avani. Now, without further ado, I would now like to introduce the speaker of the day, Vaidya M. Prasad. He is a native of the central districts of Thrissur, Kerala. He received his BAMS from Vaidyaratnam Ayurveda College, Thrissur, and he did his post-graduation in Salika Tantra from Government of Ayurveda College, Trivandrum. In 2006, along with his wife Vaidya Sheniya Varma, they established their own facility called Sunetri Ayurveda Ashram and Research Center in their home district, Thrissur. He served as a foundation principal and medical superintendent for Ashtangam Ayurveda Chikitsalaya and Vidyapeetham for 5 years. He is also engaged in exploring the possibilities of informal Ayurvedic learning and teaching and is engaged regularly in conducting learning programs called Samikshas. This year, he is appointed as Guru for CRAV program by Rashtriya Ayurveda Vidyapeeth, New Delhi. I now invite you, sir, for a much awaited session.
Namaskaram. First of all, let me extend my happiness and gratitude towards Chinmaya Vishwavidyapeetham for making this platform a reality for this webinar called AYU-SAMVAD, an initiative of Rashtriya Ayurveda Vidyapeeth, New Delhi, which is an autonomous body under the Ministry of Ayush, Government of India. And as mentioned in the introductory note, we are all waiting, actually, literally, for a possible third wave of the global pandemic, COVID-19. We'll be going to the details of the pandemic, as well as the possible ways to keep every one of us in the society safe, and what the Indian system of health and well-being called Ayurveda can do, contribute, help in this regard. So once again, I express my gratitude to all the concerned with Chinmaya Vishwavidyapitham, and also to Rashtriya Ayurveda Vidyapitham for this wonderful initiative. So can I share my slide? I'm not made a co-host. Still I can, I hope. Yes. So this series is actually named AYU-SAMVAD, a fight against COVID-19. First of all, I would like to say something about Ayurveda in a couple of slides. Ayurveda is an Indian system of healthy living, maintaining well-being, not in the personal level alone, but for everyone, in the family level, in the social level, in the global level. Everyone should be happy and healthy. That is the mission of Ayurveda. The word Ayurveda literally means the knowledge or the treasure of knowledge about life and longevity. And it is basically a pro-host approach towards health and well-being. Pro-host approach means the individual, the person, that is the most important component in it. Then there will be a question. I can smell a question. Is there a different approach? Answer is yes. Especially maybe after the invention of microorganisms as the major causative factors of diseases, there is a big shift in the approach. We are looking for guest factors, factors outside our body. We are the host. Factors outside the body who are always threatening us to cause diseases. So we are always ready to fight against them. But a pro-host theory is not like that. It is for the host, focusing on the host. Whatever the element is, we have made it a point to make or put our house in order. So it is not against, but it is for health and well-being. It believes in the innate capacity of the ojas, chetana, balam, the individual's capacity, host capacity. And that is why three major engagements of a living body is becoming a very crucial point of discussion in Ayurveda. They are, number one, seasons, ritus, the 6 seasons as we identify it in India. It is not 6 in many other countries, especially in the West, it is 4. Here in India, we actually consider the Ritu Chakram, the cycle of seasons, accommodates 6 Ritus in it. Then the sensory objects or even sensory pleasures, which our sensory organs perceive in the form of smell, taste, form or color, light, touch, and sound. How do we engage with these sensory objects? Then our actions, karma, in 3 different planes: physical, mental, and verbal. Kaya, chitta, vak, bhedena. 3 types of our karma. So these 3 major engagements, Ayurveda makes it a point that it should be optimal. The engagement with these 3 things of every living body should be optimal. Samyag. It should be samyag. Not in excess, not scarce, and again not perverted, but optimal, samyag. That is the one and only condition to keep ourselves healthy and happy. Yeah, these 3, actually 4, initially it was 3, the first list was having 3 pillars, but to make it more stable, we added 1 more. So 4 pillars which support the body for a healthy life. They are ahara. Ahara means food. Then vihara, which contains 3 aspects here. 1, nidra. Nidra means sleep. Then vyayama. Vyayama means exercise. And abrahmacharya. Abrahmacharya is a word which is having many meanings, but here it encompasses all the emotional status. So when you have proper ahara, proper nidra, proper vyayama, and a proper emotional status, these 4 pillars support the body properly. So whenever your body has gone out of track, you have to find which of these 4 pillars, sometimes 1, sometimes more than 1, is destabilized. This is very important. Diseases, ailments are understood in Ayurveda in multiple ways. Basically, they are divided into physical ailments and mental ailments. That is one type of understanding vyadhis. Another type of explanation is intrinsic or host-oriented. Second is extrinsic, something which is caused by external. Then there is a point. Previously, we told that it is fully host-oriented. Now we are talking about host, guest. Actually, there is no contradiction. Even in those issues which are extrinsic, our focus will be on the host factor. That is the difference. Yeah, these are the strengths of Ayurveda. In short, need not go for a very detailed understanding of these things. For the sake of explanation, I have included this as suggested by the authorities. Strengths of Ayurveda: comprehensive definition of health, which I've already explained, acceptance by the community. Yeah, it is well accepted in almost all parts of the country. Emphasis on promotion of health and prevention of diseases. Two aspects: health and prevention of diseases. Importance of diet and lifestyle. A holistic concept. Highly individualized approach. Meantime, it's postulates, it's theory, it's siddhantam, it is universal. Stress on public health, use of natural products, basically, multiple areas of clinical strength with multi-specialities, and a very unique therapeutic approach. Now let us come to the topic of the day: COVID-19, the global pandemic. As per the statistics available, yeah, this is as per yesterday's counts. In India, this is the total number of coronavirus cases. Second line shows the deaths: 4,27,892. And obviously the third shows the recovered. And the count is still going on. Coming to my home state, in Kerala, as per yesterday's available data, this shows the picture. This is total confirmed plus 1 day extra. These are the active cases as of now. These are the recovered cases, and this red square shows the deaths that has happened. So we are living on such an unprecedented health crisis, wherein all facets of life, personal, familial, social, economical, political, all facets of life, human life, is severely affected. And maybe after some nearly 20 plus months, it is going to be 2 years very soon. Still, we have not come out of the crisis. The threat continues. Our children are out of their classrooms for many months. The examinations are going on in a very different manner. Classes are all virtual. Even the human relations have become virtual. So is there a way out? What the traditional wisdom that India has acquired over millennia can help, can do in this crisis? But what we are already doing, what we have done, all these things are very, very important. We have to make use of all available resources, and we should have a thorough understanding how we are going to move forward in an expected situation of a third wave of the pandemic. Yeah, these are the basic details which are known to everyone by this time. So I'm not going to the very technical details. It's incubation period of the disease, the major symptoms, because I think even the layman can teach us about what all are the symptoms and what all are the signs of this problem. Because we all are, through this spectrum of presentations, experiences, through this 1.5 years time. The management principles basically focuses on prevent the guest from entering into our body. Then, if at all it gets an entry, prevent it from multiplying and causing damage to our vital systems. And Ayurveda has got very specific strategy to achieve all these things. How to prevent the prophylactic measures, how to stop the replication in case of an entry, and how to avoid damage if at all we go through a disease episode. So we'll be considering the preventive aspects, the treatment aspect, and the post-COVID care, which is also becoming very, very important these days. How do we strategize the post-COVID care? Now let us see the prevention, what we were doing, what all are possible things, and what will be our strategy forward. See, from the very beginning, Ministry of Ayush, Government of India came out with Ayurvedic preventive measures for self-care during the COVID-19 pandemic. This was available everywhere, and this is still available and still in operation. There are many advices which are effectively practiced. Still, many people are through this. These practices are helping to prevent the possible attack. So generally, this central circle immunity boosting measures for self-care by the Ayurvedic strategies, they are going to be one important part of our presentation. I'm not going to read out all these things in this small letters. Instead, I will come up with detailed explanations of all these strategies. See, generally, these are the major steps to be adopted. Ayush-Quad, that indicates one medical or pharmacological intervention. I'll come to the detail. Nasya, I will come to it. Gargling, steam inhalation, yoga practices, and golden milk. Let us see these things. Some general advices: drink warm water frequently. This helps a lot. Very simple measures. That is the advantage of all these things. These are very simple. Many a times we are converting our kitchens to the pharmacies, not going out to a pharmacy and to collect the medicines or whatever is required. Our own kitchens are becoming our pharmacies. So one major advice is drink warm water only. Now, use of these spices, which are all there in our kitchen, like turmeric, cumin seeds, coriander seeds, garlic. So make use of these treasures, which can provide you unbelievable protection against not only COVID-19, but almost all potential infections of varied origin. That is why I'm stressing on the point that this is pro-host, because forget about these things are whether they are antiviral agents or antibacterial agents or antifungals. The thing is, the point is, they can improve our body's vyadhikshamatvam. Vyadhikshamatvam, the capacity to tolerate a potential attack, and also the capacity to arrest the progress through our systems. Yeah, it is very specifically mentioned. Kitchen is the primary pharmacy. Spices are the best medicines. They can prevent infections when used in right quality and quantity in daily cooking. This right quality and quantity can be understood from the way in which you are cooking your food in your kitchen in a very traditional way, maybe for hundreds of years. How your mother used to cook, how your grandmother used to cook, how your great-grandmother used to cook. That is the way of cooking which your cells, your body, your system is very much familiar with. That itself is the protection. And the cooking culture which we are doing, we are practicing, is evolved through hundreds of years. And that has become so familiar to the body. Satmyam. So that is the most important factor as far as the innate capacity of the body to protect yourself is concerned. Now, this is one special medicine familiar to everyone, Chyawanprash. Of course, there are limitations because this is expensive many a times, need not be easy to get for every class across different strata of the society. But these are not compulsory things. If you can insist on your cooking style, your eating style, I think you need not go for a Chyawanprash. Or if you can focus on any one of these things, you can avoid many other things. So taking Chyawanprash is one excellent option for enhancing the Vyadhikshamatva of the person. Ayush-Kwad is a medicine, something like a herbal drink, which has these ingredients. Tulsi, this is raisins, this is dalchini or cinnamon bark, this is black pepper, and this is ginger. So a herbal drink boiled out of these herbs, named as Ayush-Kwad, is going to give you excellent Vyadhikshamatva. Yeah, this is the way in which it is made. Daily consumption of this tea can be beneficial in cough, fever, cold, etc. That is an additional advantage in case you have already these symptoms. And for taste, you can add some jaggery or lime juice. 1 to 2 times this Ayush-Kwad a day, that is going to be very much helpful. Now, the powder form of this Ayush-Kwad is also available in the market for those who find it difficult to prepare this at home. This is another option. Again, this is not compulsory, optional, gives an additional advantage. It is known as golden milk or turmeric milk, no problem. Half the teaspoon haldi or turmeric in 150 ml hot milk once or twice a day. This is again and enhances the general status, energy level, and also increases the Vyadhikshamatva. Now, Nasya. Nasyam is a procedure which is a part of Dinacharya as per the Ayurvedic Dinacharya. Dinacharya means the daily routine for maintaining health and well-being. Nasyam, specifically we advise a medicine called Anutailam. See, it is there in the green area. Anutailam. You need not go for the technical details of doing Nasyam. Take 2 drops on your in your palm and apply it with your fingertips into the nostrils as shown in this picture. Whenever you go out from your residence, apply this Anutailam. Whenever you come back from outside, after maintaining the basic status of hygiene, like washing your body, changing your dress and all these things, again apply this Anutailam in your nostrils. 1 bottle of Anutailam, which generally has 10 ml in it, may be having a cost of 50 rupees, and that is sufficient for a 4-member family for almost 1 month. That is enough. So you may calculate how much expensive it is as a preventive strategy. And believe me, from the beginning of this pandemic, that means from the first lockdown onwards, March 2020, as a Vaidya, I am attending my OPD almost every day. Maybe for a few days when my center was taken up as a quarantine center by the local authorities, it was not working there, but then we were doing it in a different center. Till date, I am doing this Nasya as the best preventive strategy. I'm not yet vaccinated. No other medicine, just doing this Nasya plus the basic Dinacharya of Ayurveda as advised in Ayurveda. So such a powerful thing, such an effective strategy, anyone can try. So practice Nasya every day and forget about the rest of the things. Yoga practices for mental well-being during COVID-19 and also for physical well-being, no doubt at all. Mental well-being is highlighted because you all know how tough a time that we are all going through. Lot of mental stress, lost jobs, lost relations, lost engagement, many things, reduced income, cut salaries. So we all have to cope with these tough times. So we should find some way out. And again, sitting like in a confinement within the 4 walls of the house, that is going to create many other physical issues. No exposure to sunshine, no exercise. Sometimes you are not allowed to go out. So resort on yoga. It was a very interesting caption in the beginning. When you are not allowed to go out, go in. Yoga helps you for all these things, to some sort of a reinventing ourselves. Then what is going in Kerala? That is another important aspect, because Kerala is in the focus many times now for the increasing number of COVID cases. From the very beginning, that means from April 2020 onwards, there is a state Ayurveda COVID response cell operating in the state of Kerala, as per the decision of the government of Kerala, Department of Ayush. And this SACRC designed a number of programs for all sectors of the society, for preventive and management and post-COVID programs. All the Ayurvedic dispensaries in the state, which is something like one in almost all panchayats, they were converted into Ayur-Raksha clinics. Ayur-Raksha clinics where preventive medications and advices were given free of cost. And a program called Swasthyam, which incorporated Ayurvedic medicines and advices for general exercises and modules of yoga. That is there in place. Amritam, I think now it is not that operational because of the, it is not very essential right now, because it was basically designed to those who were coming from abroad. And you all know that initially when people started returning from abroad, especially from the Gulf area in Kerala, there was a crisis. We couldn't manage them all of a sudden. So we started quarantine centers. And for those who are in the quarantine, this special preventive program was designed, Amritam. And that did wonders actually. Now a publication on this success of this Amritam is getting ready. This is another preventive program for the aged people, 60 plus, called Sukha Ayushyam. And also for prone class, somebody who is having some comorbidities, some special class in the society in terms of health needs. So Sukhayushyam was designed for them. It is still in progress. And this was another classical program called Punarjani. This we started in way back in April 2020, where the world was not even thinking about the post-COVID scenario. Punarjani is a program which is in action for the care of post-COVID situations, complications, morbidities, health issues. It is still going on very successfully. This is another program called Niramaya, which is an online portal where you can get all the treatment options, advices, and information about available facilities of Ayurvedic treatment online. This program, which is there in place called Jiva Amritam, is a tele-counseling center or a facility giving psychological support to those who are very seriously affected emotionally, psychologically by various reasons related to the pandemic. Yeah, these are certain advices related to the diet, especially because when people started sitting inside, their food. In the beginning, I think people started experimenting with various recipes available in the YouTube. And that itself caused a lot of health issues. In Malayalam, we used to say that with the onset of, the beginning of pandemic and lockdowns, two things increased drastically. That means one is muddy, that is laziness, and second is tadi, that is obesity. So muddy and tadi, these two things started increasing like anything. And that was creating another group of health issues. So we focused on the importance of healthy food, especially overeating, untimely eating, and late dinners. excessive non-vegetarian food was creating issues. Junk, when added on with the lack of exercise, lack of exposure to sunshine and wind, many things, usage of refrigerated water. So we started campaigning. Then certain special advices like add amla and ginger, maybe in chutney form or something like that. This is an excellent recipe as well as an excellent preventive medicine which improves the vyadhi kshamatva. Then stress on moong dal instead of urad dal. Importance of vegetables and fruits. Importance of avoiding curd, pickles. Similarly, fried stuffs, refrigerated food and rewarmed foods. They were all causing issues. Even the fasting times, religious fasting times, we were releasing specific advices. How to make the fasting itself a tool for maintaining excellent health and detoxifying the system. So we came up with specific advices in designing the food pattern during the fasting times. Government of India, Ayush Department released beautiful booklets in soft form as well, about traditional food recipes. This was used widely, still available in the website. How to cook healthy snacks, healthy foodstuffs based on different culture, different parts of the country. Whichever suits you, you can take. That was doing a wonderful job. Siddha system of medicine, that was also incorporated in Kerala. There are many wonderful techniques for prevention of infections in Siddha. They were also adopted by the Ayurveda response cell. See, like Kabhajara Kudinir, Nilavemba Kudinir, Amukkura Churnam, Adattode Manappagu, all these things were made available through the Siddha Raksha clinics in the state. Now, so all these things are about the preventive aspects. Now coming to the management of COVID, it is still there. What I am reporting, it is not about the past. All these things are available even now. Only maybe a couple of days back that the Legislative Assembly, one answer was given how effective it was by the Health Minister of Kerala. Yeah, from the very beginning, guidelines for Ayurvedic practitioners for COVID-19 was released by the Ayush Department. Ayush, I hope everyone knows, this is a short form of Ayurveda, Yoga and Naturopathy, Unani, Siddha and Homeopathy. Ayush stands for all those systems. Yeah, these were the guidelines on the clinical management of COVID-19, which is still in place, which is widely in practice in different states of the country, developed by the Directorate of General and Health Service, Directorate General of Health Services, Ministry of Health and Family Welfare. And in Kerala also, this was put into practice. This was one interesting element which we already explained. This is also put into the clinical application. From the preventive side, it was already introduced into the clinical utility. Ayush Quad. Bheshajam was another program by the government of Kerala for the management of COVID positive patients, mild, and at one time asymptomatic. Because as you all know, these days the COVID patients are diagnosed based on the tests, because a huge number of infected patients or individuals, they are asymptomatic. There need not be any symptom. There are many controversies about it, whether a totally asymptomatic individual is to be considered as a patient or not. I'm not getting into that controversies. But anyway, it was getting diagnosed as a patient, and they were kept under observation until they are becoming tested negative. So there was a requirement to make this period from positive to negative as minimum as possible. So something should be given. Generally, rest, proper food, it is sufficient. But safe medicines from the Ayurveda was seen to reduce the gap from the tested positive status to the tested negative status. That is why we designed a program for asymptomatic patients. The idea itself is a little bit interesting. Asymptomatic patients. But it is a requirement, it is a need even now. Because these asymptomatic individuals can become carriers and sometimes spreaders, sometimes even super spreaders. So they were also kept under observation. So Bheshajam started giving Ayurveda Yoga integrated program to asymptomatic, mildly symptomatic and moderately symptomatic persons. And again, that created a big step forward in the management of COVID-19. This is, I think, a little bit technical. You need not bother about it. I just put this slide, that's all. It is a ready reckoner at a glance for holistic management, different stages of COVID, released by Ayush Ministry, prepared by All India Institute of Ayurveda, Delhi. Pre-infection stages: asymptomatic, mild, moderate, severe. Severe symptoms were not treated as standalone Ayurvedic methods, because we were all in a panic at that time. Nobody was having an answer. So everybody was in panic. And this is for the cured rehabilitation, the post-COVID. So accordingly, a list of strategies: gargle with haldi and salt solution, guduji with pipali churna, ayush kvadha, many medicines. Forget about the medicines. But what my intention is, there is a program which is found to be very effective by all means. Now, this is another important thing that we developed. Ayush 64. Ayush 64 is a tablet, 500 milligrams tablet, and it was advised to be consumed as 2 tablets twice daily, and each tablet consists of these ingredients: Saptaparna, Kaduki, Kiradatikta, and Kuberaksha. Forget about the names, it is available in tablet form. And this was doing very good in the asymptomatic as well as that mildly symptomatic patients. It's maybe one of the easiest and safest pharmacological intervention that Ayurveda offered as a ready reckoner. Generally, Ayurvedic treatment is very much personalized. But when you have a pandemic and you may not be able to see and consult the patient on a highly traditional personalized manner, you may require something which can be used in all individuals, irrespective of their personal unique characteristics. So Ayush 64 was helping, doing wonders that way. and it is still in wide use everywhere. That is Ayur 64. Now, yeah, these are some general information. Ayurveda medicines are widely used everywhere in the country. Specific protocols are developed. It is there in practice for different stages of the disease, and it is updated from time to time. And when there is a protocol, still in a direct consultation, the Vaidya will have the freedom to take the individual as a very unique person and prescribe, considering all the variables like the Prakriti, Desham, Kalam, all these things. That is very unique. That is very original idea in Ayurveda. Yeah, these are some advices by the All India Institute of Ayurveda, like what can be done. Long list of medicines, forget about it. This is the Bheshajam protocol, first page, which gives you the freedom for the use of a different set of medicines in different persons. Essential drug list was published by the state Ayurveda COVID response in Kerala. These are some examples of medicines which are widely used, like Bharanyadi Kashayam, Vyaghriyadi Kashayam, Dasamulagadatrayam, many things. Don't think that these are substitutes. Like if Bharanyadi is not available, you can go for Vyaghriyadi. These are all for that personalized prescription as per the classical methodology of Ayurveda. Now, there could be some frequently asked questions. How do Ayurveda approaches newer diseases? Whether newer diseases which are being evolved, are they explained in the classics, in the treatises? How do you approach? That is very interesting. Actually, Ayurveda is not explaining each and every disease independently. Contrarily, Ayurveda explains the way in which a diseased body is to be evaluated, or a diseased person is to be evaluated in terms of his functional status, and also in terms of some technical aspects of Ayurveda, like what is the status of his dosha, what is the status of his dhatu, and what is the status of his mala. So whatever name you give to the disease, the person is evaluated. And the possible ways of response of a living body to different disease-causing conditions. That is why we told that it is host which is going to be considered. How a living body will respond to a stimulus. That is well studied, and that is developed into a tool. Using that tool, all disease conditions are addressed and the management program is strategized, which obviously includes the so-called infectious diseases, pandemics, all these things. That is the second question. Can Ayurveda address infectious diseases? Then, are Ayurvedic medicines safe? That is another frequently asked question. I should say yes. If you are taking the medicine as per the advice of a trained Vaidya, considering your unique nature, unique characteristics, your Prakriti, your sleep pattern, your eating capacity, the potential of your Agni, all these things. And if you're getting a properly prepared medicines, definitely Ayurvedic medicines are, Ayurvedic methods are 100% safe. And what are the advantages of using Ayurvedic medicines? Number one, they are safe. Number two, they are using mostly the natural products. Number three, there are very less chances of developing further complications, because the proper Ayurvedic intervention has got three components. Basically, it is corrective along with curative, and three aspects, three components will be taken care of. Number one, your lifestyle. Number two, your diet. And third is the proper medicine. So when you have a proper lifestyle modification, when you eat properly and you have the right medicine, the advantage is that this intervention will not focus on any one disease or one ailment. It is offering health, not just cure of a particular disease. And side effects, which I already explained in the earlier question. And is it possible to have emergency management with Ayurveda? That depends. That depends on where you are for the care. There are centers which can provide Ayurvedic emergency management, but you cannot expect always. That is why the third grade patients of the COVID, they are not yet addressed in all treatment centers of Ayurveda. Where you may require some life-saving technological support, that you may not be able to get in all Ayurvedic centers. But interestingly, during this COVID episodes, many of the end-stage COVID patients were rescued literally using Ayurvedic medicines in intensive care units, of modern hospitals. So that shows the importance or the potential of working together between different systems of medicine. Our country has got the potential because we have got many systems of medicine which has got many strengths in many domains. So when we design an integrated approach of the specialists talking together, sitting together, discussing their potentials and limitations, I think COVID-19 has shown us the way for a better futuristic way of healthcare. Post-COVID care is very important. Many things are evolving. Damage to the heart muscles and heart failure, damaging to lung tissue, loss of sense of smell, thromboembolic events, anxiety, depression, pain in joints, many things. For all these things, fortunately, Ayurvedic treatments are working well. Unless and otherwise, the damage has gone so extensive, so irreversible. And we use lots of rasayana. The concept of rasayana is restoration of body, physically and physiologically and anatomically. So we have many things to offer. We are doing it, and I am very confident to say that even if in the event of a third wave of COVID-19, definitely we all can resort on this preventive strategy, which I've already advised, and also the management programs, which I mentioned in this presentation. With that, I conclude this presentation, and I express my special thanks to my students from RAV, Vaidya Sheetal and Vaidya Ashwin. And once again, I express my happiness and gratitude to Chinmaya Vishwavidyapitham for this wonderful opportunity. If we have a couple of questions, I'll be more than happy to take them on this platform. Thank you.
Namaste, doctor. Can I have a question?
Sure.
I'm Sridhar from Tirupati.
Namaste, namaste.
Namaste. Now you mentioned about Anutaila for nasal treatment.
Yes. Yes.
So can we simultaneously do the Jalaniti as well for cleansing of nose along with Anutaila? Because I practice Jalaniti almost daily. For some reason I have stopped it now, but can I continue?
Definitely. Definitely. But even if you are practicing Jalaneti, my request or advice is please do this Anutailam as well. You need not go, of course, as you know, this Jalaneti is a technically sophisticated one. You have to get trained it properly, otherwise it is going to create issues.
Yes.
Nasyam is also a technical one, but this particular application which I suggest is not technical. You take a few drops of the medicine and just apply it inside your nostrils. That is enough. So even if you're practicing Jalanedi, please do Anutailam every day, at least twice, once in the morning and once in the evening.
Okay, and along with it, the sutra thing which we use, I forgot the name, the exact yogic term. Sutra you put through nose and cleanse your nasal and also the throat.
Sutra Neti?
Sutra Neti. That also can be continued.
You can, if you are trained, if you are familiar with it, you can.
I am trained for that. I have been practicing it. So
then definitely you can do it.
Okay. Namaste. Thank you.
Namaste. Thank you.
Sir, we also have a few questions in the chat box. One of the questions are Ayurvedic Siddha clinics in Kerala. What are the ones that are there outside Kerala?
Yeah, Ayurvedic or Siddha clinics are just I mentioned the names in which they are popular in Kerala, that's all. Whereas the similar facilities, maybe in different names, are available everywhere in the country. So the corresponding Ayush departments in the respective states have come up with a lot of programs for which the basic idea which I presented in this session is the key. They follow because it is based on the Central Ayush Ministry's advices. So the same program is available all across the country in all states. But the names, forget about the names. I highlighted it just because I'm closely associated with the activities in Kerala state. That's all.
We also have one more question. Can we have the names of the things that doctor mentioned to be used regularly, plus the nasal oil?
Sure. That Anutailam, I hope you all remember. Anutailam is the one which I suggested for nasal application. I think that is the most important strategy to work as the preventive method. Whenever you go out, you put it. Even if you are not going out, you are within your residential facility alone, then also you apply once in the morning and once in the evening, because many people may be moving around. You need not be knowing whether somebody is a carrier or not. So as a routine, apply it twice a day. And whenever you have an outing, going out from the home, then definitely before that you apply, and back home, do it once again after your body wash and changing the dress and everything. That is the most important. Then the spices which I mentioned, it is already there in our kitchens everywhere, like the turmeric or the ginger, then the garlic. All these things are excellent. Lime can be added but don't go for extreme uses of these things, because they are going to be counterproductive. So keep everything in moderation. Then that Ayush-Kwad is nothing but a herbal drink, which all these things can be used, especially that this cinnamon bark. Cinnamon bark is again an important component of that Ayush-Kwad. That also is important. Then I think you need not bother about much of the medicines, and make it a point that you are eating properly in time and you have good appetite and you never overload your system. Do exercise, preferably yoga exercises. If you have an access to maybe an outdoor exercising facility, like going for walk or for jogging, make use of it to the best. Whenever possible, expose to sunshine and natural wind. Make the food fresh. Don't go for late dinners. Sleep properly, maybe 6 to 8 hours according to your age and profession. And practice deep breathing. These things are sufficient. Nothing is going to happen. As long as your Agni is intact, and as long as your entry portals, in this case of COVID-19, the portal of entry is basically the nostrils. So if you practice that Nasya, and if you keep your Agni, the digestive fire, intact, nothing to worry about. And if at all you are taking some medicines for some other comorbidities like diabetes or something else, keep them under good control. Don't skip your medicines, and make sure that your comorbidities are well under control, and stay safe. Nothing to worry about it. Don't get panicked.
I hope you will address how to cope with post-COVID fallout like hair falls and breathing issues and other issues we face after COVID.
Yes, generally, once you are shaken, I should use it, shaken by the infection, the COVID-19, in general cases, I think you will come out of it without any major injury in most of the cases. But when you are literally shaken by the disease, there are possibilities of these sort of issues, especially loss of sleep, then muscle pains, then severe fatigue, hair fall, shooting up of comorbidities like diabetes. Many things are happening like this. So for such cases, ideally you take the consultation of an Ayurvedic Vaidya, because I think self-medication may turn out to be dangerous. So don't try self-medication, especially you have gone through a very extensive medication for coming out of the ailment, and your general condition, general health has depleted seriously, then never go for self-medication. There are many options, as we find that one point called Ashwagandha Arishtam in the chat box. Ashwagandha is an excellent restorative medicine. Similarly, according to the conditions, we use medicines like Indukantam Kashayam many times, Indukanta Khritam. For those who have already some problems with the lung, sometimes conditions like lung fibrosis happens, then you may require a long-term medication, but it is reversible. Let me tell you, the lung damage which is happening post-COVID, in most of the situations is curable, is reversible. There are wonderful medicines in Ayurveda like Pippali Rasayanam, Agastya Rasayanam, Brihat Chagaladhyam Khridam, many medicines. Amrita Prasham, Kushmanda Rasayanam. So my advice is, get a proper advice, proper consultation from your Vaidya, family Vaidya, and don't waste time. Come out of the issues as early as possible.
Necessary adding jaggery with Ayush-SAMVAD?
It is not necessary. It is not necessary, especially say if you are a diabetic, adding jaggery may be even counterproductive. So it is not at all essential. It is just like a taste enhancer or something like that. You need not bother about it. Instead, even you can use maybe a spoon of lime juice if you prefer to, or you can take it as such. No issue.
If anyone has any other questions, you can either put it in the chat box or say it out loud. We have one more question. Ashwagandha Arishtam, how is it useful to reduce stress?
Yes, Ashwagandha has got a wonderful effect physically as well as mentally. It can work in the mental plane by reducing the anxiety levels, stress levels, and also work as a mood enhancer. And it also helps in giving you good sleep. Interesting thing is that in changing the dose, it can work in both ways. It can increase alertness as well as it can induce some sleep. So dose specific action is there for Ashwagandha. Ashwagandharishtam is a preparation out of ashwagandha, which is a self-fermented form of the medicine. And that is giving you good general health, enhances your Vyadhi Kshamatva, and also works well with the emotional factors like stress and anxiety. It is a good medicine that way.
Is there any other questions? Then I think
I see it's Arundhati. Namaskar.
Namaskaram, namaskaram, Arundhati ji.
I see the questions in the chat. There is a question being asked for children. What can Anutailam be used for children?
Definitely. And definitely. You can use for all children. See, you have to be very mild on the children, no doubt, but it is not contraindicated in all age groups.
And generally for children, what would you advise besides, yes, Anutailam, would you advise any other, like, the Kwatha, the Ayush Kwatha, maybe for adults only, or even some of the other kadas, maybe something which only the adults could have?
Yes, the medicines of that Ayush Kwad need not be made in the Kwad form, but you can make it something like a drinking water. In its milder doses, as if we are making the chukkuvellam in our kitchen. So that can be used for all members of the family, including small kids, plus Anutailam. And keep an equal eye of importance on the diet, which I discussed in detail. That is very crucial. When your digestive system is overloaded, the body's entire focus will be on churning it out and making that ready for the next phase. So obviously your Vyadhi Kshamatvam will be very low. So that is also an important point as far as the kids are concerned.
Earlier there was a question on some of the lists of medicines and things were in Malayalam. Is that also available in English or Hindi?
Actually, those Malayalam slides were not at all about any medicines. It was just about that programs. It was that propaganda flyers for that different programs of the Kerala government. It just mentioned the names of that programs, nothing else. There was no medicines mentioned in it. I could not make it in English or Hindi because they are standard release from the government of Kerala. So I just showed it, that's all.
Okay.
All the other information I presented in English only.
Okay. Understood. All right. Okay. So it was very useful. Thank you.
Thank you, ma'am. Thank you.
there's one question for students: what can be used for memory?
I think it's not a question connected with COVID-19. Anyway, Saraswadarishtam, they have also put the answer also. So yes, Saraswadarishtam is a good option that way. But I think in my experience, these days, the students have poor memory because of their overindulgence in electronic gadgets like mobile phone. So Saraswadarishtam cannot bypass that issue. So I think it should be a holistic strategy.
Is there any more questions? I think we have answered all the questions, sir. Okay. Thank you so much, sir, for such a wonderful and informative session. I now invite Anusha for the word of thanks.
Hari Om all, and thank you, Shara. I would like to express my gratitude to Mr. Vaidya Prasad ji for taking out time from his busy schedule to take this wonderful and informative lecture for all of us. I would also like to thank Chinmaya International Foundation for creating this opportunity for us. And thank you to all the Seva volunteers and all the faculties of Chinya Vishwa Vidyapeeth who have helped us plan this event. And also special thanks to Brahmachari Sudhir Chaitanya ji, the Seva team coordinator, and our faculty coordinator Bindu ma'am for taking up the responsibility of conducting this event. And last but not the least, thank you all who have attended this webinar. And I would now call upon Avni for the ending prayer.
Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnamevavashishyate. Om Shanti Shanti Shanti. Hari Om Shri Gurubhyo Namaha. Hari Om.
Thank you very much. Thank you. Thank you all.
Thank you, Prasadji. Thank you.
Thank you.
We also have an announcement. Those who are interested to organize webinars like today's session, please contact us at seva@cvv.ac.in. Thank you.
Meenakshi, are you there? Meenakshi? Yes, yes.